we're inviting these folks on as having been involved with the research, with Claire Joseph's project in particular, but as two professors who really are very excited about and passionate about student research that addresses equity and inequity and social determinants. And so we wanted to have a discussion about what that looks like in the academic world from the perspective of a professor, but also as a student. Heather, how do you feel about, have you got some questions ready? Did you want to take the discussion on it?
I did. We've been talking about, equitable opportunities, and we've been talking about voice, and something that struck me, particularly in being involved with an undergraduate student, Claire in particular, is what we can do as those who support you in terms of ensuring equitable opportunities for you to develop in research and to grow in your work and what you want to contribute. And I was wondering if either of you could speak to that, about what we could do to support your work and your voice going forward.
I'll start, and I know Alexa has some ideas about this as well, but I've been thinking about all the support that really was required for me to get this project done, and it does kind of take a village, and so it takes leaders and mentors such as Heather and Debbie for me, who really guided me on this project, as well as the time. Like when you're an undergraduate student, I think that having the support and the funding from Research Nova Scotia, who was willing to take on some undergraduate student projects, really did help me to kind of make this project come to life as somebody who does have commitments to, continue their education and everything like that on top of the research part. So those are definitely the supports that I needed for sure to make this happen, and the support that has gotten me to this point. And then, moving forward, there are still a lot of challenges and barriers in getting this research published and getting this research out there that I do still need mentorship and guidance on, and to try and help this to kind of have that knowledge translation and distribution kind of more widespread. And Alexa, what do you think?
Yeah, definitely. I mean, I wouldn't be here today if it wasn't for the support of my supervisors. And as well, I see a couple of my research team members on here as well, Melissa, Antonia, and Brian as well. I was also very fortunate in that I was given the opportunity to kind of pick where I wanted to gear my project towards, and was able to pick something that I was very interested in and passionate about. So that made it a little bit easier to actually complete this research. And then just having support of an entire research team, I think I was very lucky in that respect. And then Claire and I, we've talked about, we both received funding for this research through Research Nova Scotia. So that was instrumental in being able to complete this over the summer after our third year. As well, speaking with different professors and supervisors who have different areas of expertise was definitely very helpful in completing this research.
Oh, you're muted, Heather.
Oh, great. That's great. Thank you. I guess I was also struck, I think it was a question that Debbie was asking in the chat about how this research had most impact on you personally. You alluded to that a little bit in your presentations, and what challenges particularly are you going to find moving forward this work? And I noticed another question in the chat as far as getting those in rural areas to participate and to share that lived experience.
Claire, did you, or Alexa?
Yeah, I can definitely speak to that. With my project in particular, I was looking for participants that were within a certain kilometer distance that kind of met our definition of rural for our project. And, you know, there are many, many different supports that exist in these areas, but we did find that even some of the participants who were willing to participate didn't meet the other criteria, which is you had to have supported a racialized student in the past, I think it was 5 years that we required. And I think that that does kind of really, that really did that struck me during my analysis process, just thinking about that as a barrier for participation. You know, kind of showing the magnitude of the barriers faced by racialized students in trying to access sexualized violence services, because, you know, the numbers show us that this is happening. This is happening to people all the time. And just the fact that I even had some of my participants come back and say, I would love to be a part of this project. I don't have that experience. And so I think that that really also kind of fueled the need to do this project, and it fuels my need to kind of want to go further and actually speak with the students themselves and ask them, what were your barriers? How, like, why didn't you even, like, what kind of prevented you from accessing it? What kind of things facilitated those who were able to access it? And how can we recreate that to kind of overhaul the experience of accessibility around sexualized violence services for racialized students in particular? And yeah, so the rural environment was a bit of a wasn't another level of barrier. That was another kind of like intricacy to that complex research problem that I kind of described, because we know that you know, racialized people have difficulties accessing health services. Rural people in general, racialized and non-racialized, have difficulties accessing health services as well. And so when you kind of put those on top of each other, we're talking about kind of the intersectionality there, and the intersecting experiences of inaccessibility and barriers to healthcare services.
Yeah, definitely. To echo what Claire was saying as well, really getting that rural urban mix was very important to my project, because, you know, as we know, homelessness looks different in rural areas as opposed to urban areas. And so it was very important to capture that rural side of it. And you know, even just speaking to people in rural areas and having, you know, internet connection was an issue, or their camera didn't work. Those also just reiterated those, you know, barriers for rural services. You know, technology has been almost seen as a social determinant of health throughout this pandemic, has been very important. And so, yeah, making sure that we capture that lens, and then how do we mitigate the barriers to actually capturing that. And where I was interviewing service providers, you know, my impression was that people in rural areas were they were excited to be included in this research, because of a lot of the time, you know, rural places, because of these barriers to getting their, you know, perspectives, they're often not included. So making that a priority was very important for my project and our research team. There's definitely going to be more barriers as the larger team looks to interview people who are actually experiencing homelessness, and working around those barriers is something that we're working on right now. But yeah, that was definitely a big piece of my portion of the project.
Heather, can I just jump in with a quick comment? I was thinking about Alexa's project in particular, and rural homelessness. And just over the weekend, I was in a really rural community in Cape Breton, and I was talking to a homeless woman who was living there. And, you know, internet connections wouldn't work for her. There is no shelter in this teeny tiny little community. Where she lives, she literally lives in the bush. She just lives in a tent. Sometimes not even in the tent, right? Like she just lives in the bush. And so when I think about even some of the strategies again that we come up with, you know, that we tend to think of, you know, internet, for example, or at a homeless drop-in or at a center. There is another layer yet of homelessness that doesn't get addressed by that. So. It's just what Alexa was describing sort of made me think about that piece too. That's all.
And that definitely goes along with making sure we're capturing, you you know, the perspectives of people who are experiencing these things themselves, and the people who are working in these areas, because they are the ones who kind of know the intricacies of, you know, the homeless system and that network. And as someone looking at it from outside, it's hard to kind of actually know the realities of what's happening. So yeah, that's why, you know, this research is important to capture here and now, and to make sure that we can learn and improve and use this knowledge going forward. And yeah, thanks, Diane.
Can I jump in too? Can you hear me? Sorry, I'm outside. So I hear the wind blowing. So that's why I have the headphones on. It's so nice to see everyone. And I know some of the folks that are on your team, Alexa, from previous work with Nova Scotia Health Research, but I can't stress how proud I am to see 2 undergraduate students doing this work. And the other thing I'm wondering about is, I'm in a leadership role where I'm determining directions within a university system. And I'm curious what you would suggest as we try to make changes and revise how things are happening from that lens that you talk from. What suggestions would you give some of the leaders in academic administration? What would be the one thing you think needs to be done right away to ensure that because we have to ensure our faculty are thinking with these lenses. So I'm just curious, how do we help those that maybe haven't been immersed in this way of thinking and working with students and within communities and within their practices?
I think that for me, what I would say as the first thing that we have to do is, you know, start including the voices in the conversation. It's going to be, you know, it's difficult for one person to say what needs to be happening, but just like, you know, making sure that there's avenues for all community members at the universities that the leaders are involved in to voice their concerns, to feel welcome, to feel included, to have services and forums where they're context specific and their voices are valued and their voices are heard, and just to hear the suggestions from them. I think that that is the most important first step. And then, you know, leadership can take great direction from there, because they, you know, as Alexa was describing, they are the experts on the intricacies of their own situations, right? So that would be my first step that I would recommend. What about you, Alexa?
Yeah, I definitely agree. In terms of what you know, leadership can do at the academic level to make sure like things like this are being included in the curriculum. I mean, I know I was first introduced to what an honors thesis even was, is because Antonia actually came to our research class and presented her honors thesis. And that was the first time I even heard, oh, this is something that maybe I can do, or I can, I should look into this a little more. This is something that I think I would really like. And, you know, this is, I think I can really get the most out of my undergrad by doing this kind of project. So just kind of showing people that this is something that you can do, and promoting it. And I mean, just doing things like me and Claire are doing now. You know, there was only 2 nursing students in the whole class who even did an honors project. So just showing people that, you know, this is an option. It's really opened my eyes to the research field. And I think this will have, you know, I will probably be doing research for the rest of my career. So yeah, just kind of showcasing this work and making it available to people and saying, you know, it's really not that hard, like anyone can do it, is a really great message, I think, as well, in addition to what Claire was talking about.
Thanks, Claire and Alexa.
Heather, you're on mute.
To build on what Debbie was saying, if you could have a magic wand, I always like to ask this, you have a magic wand, what kind of funding / publication opportunities would you be at the top of your list right now? And what would you do if you got that funding and that opportunity in your continuing work?
If I could have a magic wand to continue this work, I think that, you know, right now there are kind of systems in place with the nursing education where I couldn't go directly into a master's until I've had 2 years of work experience, which I do understand like some of the reasons behind that. So as much as I think like my ultimate magic wand would be to say that I'm allowed to do a master's now to continue my education and to just kind of get better at research, work with more researchers, and kind of have that kind of support as I continue this project. That's my ultimate magic wand dream. It's not really super realistic. So I think just to be able to kind of have some support and some funding to get this project to publication before I reach that kind of 2-year mark, that would be my ultimate goal, because doing the work was so fun and so inspiring, and I got such great rich data from all the participants, and I just want to kind of do them justice and kind of get their voices heard and kind of get this information that they gave me, which I find super valuable, super insightful, and super inspiring to encourage better accessibility of sexualized violence services for racialized students, just to get that out there and to get that published and get more people hearing about it, and kind of honor their contributions at the best way that I can.
Thank you. What about you, Alexa?
Great. Yeah, I definitely agree with everything Claire had mentioned. I have continued after my undergraduate degree to continue working with the research team that I was at the Canadian Centre for Vaccinology. So I think I've been very fortunate in that way that I can continue this research with the support of a larger study team, and my results will probably get published with that larger study. So I think I definitely have been given a very good opportunity that way. I mean, definitely just having funding available for more researchers to do this type of work, definitely what I would use my magic wand for. And yeah, just getting more people involved in research, and yeah, those are my plans.
And have those, if I'm hearing too, to have those opportunities for you to get your voice out there and publish, which may or may not be as accessible as what I'm hearing as you might like, to get that voice out there. So I did notice that there was a question as well, which I think is an important one when you're thinking about people in academia and trying to mentor you, but as well as people in community organizations and partners, is how you manage your undergraduate education courses when you were doing your undergraduate research projects, and if you could let people know what that was like, and how you earned credit for this work and how you managed such a large load.
Yeah, it was definitely challenging at times. Brian will know, he's on this call. We had lots of late night meetings, as well with my thesis supervisors. But this, in terms of the curriculum, it might be changing, but when we went through it, it was a 3-credit course. So I started it going into my 4th year, working on it throughout the summer with my research grant, and then I was able to work on it throughout the whole year. But you only get credit for just 3 credits, which is like 1 regular course. I think they're looking into changing that possibly to a 6-credit course in the future. Not too sure where that is at right now. But definitely a lot of time management needed to happen, especially in nursing. In your last year, it's practically all placements. So both Claire and I were working full time. I was, in a hospital for 6 weeks, and then at the community center for 3 months. So it was kind of like having a full-time job in addition to working a full-time job. Yeah, Claire, I don't know if you had any other insights to add to that.
Yeah, it was definitely challenging. I spent my 3-month kind of full-time placement in an intensive care unit during the pandemic. So that was obviously quite an intense workload, but St. FX does have like a really unique and special honors program. And I think Debbie helped to develop that and kind of create these opportunities for students. So I think kind of what helped me to manage my course load was just how much I was obsessed with doing the research and how exciting of an opportunity it was. That kind of passion can fuel you through many late nights and many early mornings. And Obviously, just also having the support of Debbie and Heather, who were always, very encouraging. And, because it can be quite difficult to do something that you've never done before, and just hear negative feedback all the time, and be working so hard. So honestly, I cannot stress enough how important it was for me to have their support and the support of my supervisors, to kind of help me to manage that course load. And also like the support of like the other honors students. Alexa and I, we had like a little group chat going on, and we would just provide support to each other, and make sure we're staying on top of things, like check where the other person is at and kind of move through it like that. And Debbie also facilitated some chats with like all of the honors teams, and where we could kind of share together where we're at and what our goals were and where we're moving towards, and that helped me to stay on track. Alexa and I were also talking about what like supports that could have been really awesome, and that might be really awesome for future students who go through it, which is to kind of have like an honor student support network that crosses different faculties. And because for us it was really great, but there was only 2 of us at sometimes, right? And so just having more students who understand what it's like and who are going through it just can help just have some camaraderie, right?
I know that I think our hour is coming to a close, but I keep thinking about what you were both saying about creating collaborative community responses, and that's with academia and with community organizations and with your own voices and funding and support. So you certainly have given us a lot to think about, and what we can do to enhance and grow and move this movement of undergraduate student work, reaching this type of caliber. It's just wonderful, and congratulations to both of you.
Thank you. And thanks everyone for listening today. I really enjoyed sharing my research with you all.
It was wonderful. And thank you, Heather, for that. And I'm thinking about, I just want to add one thing before we tie up. I'm thinking about that concept of a network, of an honors network or some support, so obviously here we have 2 brilliant nursing students. There are other faculties at an institution that might also be doing equity focused type of work or that are having on it. So if we can connect the nursing students with nutrition, maybe there's some students in psychology, maybe there's some students in anthropology, maybe there's some in education. So it's sort of a cross discipline, cross faculty type of network and support. I think about as that student honors, like how do you manage all this stuff that goes along with doing the honors? But then also that I've always got the equity brain on. How do you bring more equity focus in, and how do you bring more social determinants focus in? Again, that can maybe the nursing students can learn from anthropology, who can learn from nutrition, who can learn from education, and so maybe there's opportunities for cross faculty, like second readers for the thesis, or another supervisor, or just a network of equity, social determinants focused folks at the institution that might be willing to link up with resources. Or and Debbie, you had your hand up, which I'll wonder if you have a question before we tie up.
Oh no, I was just clapping for them.
Lots of virtual clapping.
Yeah.
Well, and we all should clap, and that's a nice way to end it. I can't thank you all enough for this. And Claire and Alexa, I am just so proud of both of you, at the quality and the integrity of this work, and just the grace with which you present yourselves. It's quite a model to present for other young emerging professionals, and I'm just really glad we got to collaborate a little bit. So congratulations. And if anyone online wants to get in touch, Jamie, maybe I'll ask you to just flip up the very last slide with the contact information. Certainly we'd be happy to hear from you at NCCDH, but we can also put you maybe in touch with the speakers directly if you wanted a bit more direct information. So there it comes. So that's just where to find us. And for those of you who know me personally, please feel free to reach out as well.